sometimes dentists will look at me, or medical facilities, the physicians will look at me and say, well, I really didn't know that vertigo was tied to TMJ. I really didn't know that you could have numbness and tingling in the fingers, or, pain in the neck. I really didn't know that those symptoms were associated. So, I'm fascinated, just being out there over a year, and I have a background as a dental assistant, even for over 20 years, but it's still, from that perspective, working in a dental office is not the same as going out there from an outsider talking to these offices, and you see how common it is. You see quite often that people just are simply not connecting the dots. The dots are there, but they're not connecting those dots. And that's where I feel like part of my job is to come in and educate them about that, because it is very prominent.
Yep. Well, you definitely are having the same experience that I had. Good fortune. Everything is a good experience if it's an experience. I learned a lot. I learned an awful lot by doing those 41 lunch and learns. We're here to inform and to enlighten, and so that you can also, be enlightened and really understand this problem. TMD demystified. Again, keep in mind, it's all about the overlying inflammation in the joint. We'll have a lot more to say about that. So I just want to make a comment at this time. Something came up when you were talking, comes up all the time, and that is one of the symptoms, just one of the symptoms, that the patients are most assured that they have this problem, and that putting a non-surgical device in your mouth and doing a protocol isn't going to make them go away, and that is their migraine headaches. So we don't treat migraine headaches. We treat TMD headaches, totally different. But I can tell you from experience that a huge number, I'm not gonna give you a number because I haven't done a study, I haven't done the analysis, statistical analysis. It's an easy study to do. Someday when I have enough time or somebody else comes along, I'd suggest somebody really do a good study. But I do know quite a bit about migraines. I did a lot of reading on migraine headaches when I got deep into this. I mean, deep into it, above my hip. I mean, sometimes it's like up here, I'm so deep into TMD and trying to discern, mostly in the past, what was going on. But here's a fact. There are many studies about migraines out there, good studies by scientific minds, good scientific minds. But if you pull up those studies, almost always the first paragraph or two of those studies are going to say, one way or another, we have no idea what causes migraine headaches.